Now that your Noelle Total Mobile Solution Simulator is ready for use, let us take a tour of her many features. Noelle allows one to superimpose any number of issues, such as airway, breathing, circulation, or trauma issues, on top of normal or difficult deliveries. Noelle's airway can be intubated, both nasally and orally. Endotracheal tubes, NG tubes, and LMAs can be used. Intubation can be made more difficult by turning on laryngospasm. Additionally, Noelle can be ventilated with a BVM or mechanical ventilator. Once intubated sensors detect the depth of the intubating tube, ventilation and manual chest compressions are measured and logged, showing the instructor exactly how students are performing. Noelle has multiple upper airway sounds, synchronized with her breathing. Users can easily control rate and depth of respiration and choose independent left and right lung sounds, which are synchronized with selectable breathing patterns. Multiple sounds are available. Noelle is equipped with several realistic heart sounds, which are tied to a user-defined heart rate and selectable rhythms. Noelle's conductive skin sites allow the attachment of real electrodes and defibrillator pads. This feature permits the user to track cardiac rhythms and events with their own equipment, just like with a human patient. To add to this realism, Noelle can be shocked or paced with real energy for cardioversion, defibrillation, and pacing drills. An AED will display Noelle's ECG, analyze her cardiac rhythm, and advance action, a perfect addition to competency-based programs. Noelle's palpable pulses are dependent on blood pressure. Users can also disable diastolic pulses to simulate severe hypotension. Programmable blood pressure can be read using a sphygmomanometer, and users can auscultate the Korolkov sounds. Noelle has bilateral IV training arms that can be used for bolus or intravenous infusions, as well as for drawing fluids. In addition, she has IM sites on both her deltoids and quadriceps. Noelle is outfitted with a convulsion mechanism that can be used in conjunction with scenarios. Preeclampsia, for example. The severity of the convulsions can be programmed with the touch of the stylus. There are 2 different intensities to choose from. Antepartum scenarios can be generated to evaluate providers on fetal palpation techniques, and if necessary, external cephalic version maneuvers can be done. The birthing mechanism inside Noelle allows users to connect the fetus in either a vertex or breech position. To connect the articulating fetus, first ensure that Noelle is powered on and remove the abdominal cover. For a vertex delivery, connect the fetus bottom to the birthing mechanism by lining up the relevant connectors as seen here. Allow the engaging mechanism to firmly grasp the fetus. You will hear 2 cycles of the servo motor as the mechanism engages. Position the fetus in either LOP, ROP, ROA, or LOA by manually rotating it. For a breech delivery, disconnect the cap on the fetus's head and then connect the head to the birthing mechanism. There will be no engagement of the servo motor mechanism with the fetus in this configuration. For additional realism, pre-configured virtual vital sign monitors that display maternal vitals and fetal monitoring come with the NOELLE system. The NOELLE 575 is currently the most advanced birthing simulator available in the marketplace. The users can easily program the descent of the fetus and generate a vast range of maternal and fetal conditions. Let us point out some common examples. For normal delivery, the fetus descends normally. Cervix dilation is easily evaluated by standard vaginal examination, and the fetus is delivered without complications. The placenta is retrieved manually following the delivery. It can also be checked for retained cotyledons.
Shoulder dystocia. The mechanism locks the fetus to the delivery monitor and will not release until the instructor commands it to do so. The student will have to perform the necessary maneuvers to satisfy the instructor in order to deliver the baby. NOELLE allows for the McRoberts, suprapubic pressure, wood screw, and arm sweep maneuvers to be performed by the care providers. Simultaneously, the instructor will have real-time feedback on the rotational position of the head, the rotational torque, and the force being applied to release the fetus.
Breech birth providers have the ability to rotate the baby clockwise and counterclockwise to release both arms and gently deliver the fetus. Cesarean delivery users can use one of the abdominal covers to practice either a vertical emergency section or the preferred placental incision to deliver the fetus. Vacuum-assisted delivery users can use a vacuum, such as the Mighty Vac or the Kiwi, to aid in the delivery. The facilitator can see from the force display on the tablet whether the providers are pulling in line with the contractions.
Prolapse of the umbilical cord. Users can identify a prolapsed cord and take immediate action by either holding the fetus in position or pushing it back up the birth canal with the Zavanelli maneuver.
Nuchal cord. In the event that the umbilical cord is wrapped around the fetal neck, the instructor can implement realistic fetal heart rate response from the tablet PC. The students will see the variance in the strip reflecting the fetus's lack of oxygen. During any delivery, the instructor can program NOELLE's contractions or change them on the fly. The contractions can be observed on the fetal monitor, or they can be palpated on the contracting abdominal cover. Similarly, the instructor can change the fetal heart rate patterns to represent various complications of the fetus. They can be observed on the fetal monitor, or the fetal tone can be auscultated via a stethoscope on the maternal abdomen. Scenarios with the NOELLE system do not end with the labor delivery. Users can also program scenarios for postpartum activity.
NOELLE can have delivery complications that lead to hemorrhage during or after the delivery. Instructors can evaluate providers on how they manage the patient through ante, intra, and postpartum scenarios.
Other scenarios might lead to a boggy uterus that can be assessed through abdominal palpation. It can subsequently be relieved through fundal massage. For additional training purposes, the providers can practice suturing any of the 3 episiotomy repair modules. 2 medial lateral and 1 midline episiotomies are included with NOELLE 575.